Have you ever wondered why so many people over 60 wake up at 2 or 3 in the morning, even when their bladder isn't actually full? You finally drift off to sleep, only to wake up again, restless, tossing and turning, wondering why your body won't let you rest. For many older adults, especially here in the United States, this frustrating cycle becomes a nightly routine. And the surprising culprit? Often, it's not age, not medication, not even your bladder. It's the timing of your water. I'm Dr. Sophia Jain, and today I want to walk you through how something as simple as when you drink your water can make the difference between broken, restless nights and peaceful, restorative sleep. This is not about drinking less water or denying your body what it needs. In fact, hydration is essential at every age. What changes as we get older is the body's rhythm, the way our kidneys filter fluids, and how sensitive the bladder becomes to small shifts. Once you understand this rhythm, you can work with it instead of against it. Let's begin with what actually changes in the body as we age. After 55, the body naturally produces less of a hormone called vasopressin at night. Vasopressin tells the kidneys to slow down urine production while you sleep, allowing you to get uninterrupted rest. But when vasopressin levels decline, the kidneys keep filtering at almost the same pace they do during the day. That means more urine ends up in the bladder even while you're asleep. Add to that the fact that kidney efficiency itself drops with age, and you start to see why even the same amount of fluid can feel so different in your 60s compared to your 40s. Another big factor is bladder sensitivity. When you're younger, the bladder can hold about 15 to 16 ounces of fluid before it feels urgent. But after 60, that signal can kick in when the bladder is only half full. For some people, that's just 6 or 7 ounces. And once that signal gets sent to the brain, it's hard to ignore. The result is broken sleep, groggy mornings, and a body that never quite feels rested. I once worked with a gentleman in Ohio, let's call him Robert, who spent years waking up twice every night. He assumed it was just age, something he had to live with. He cut back on water altogether, tried over-the-counter sleep aids, even limited his evening walks to avoid needing to go. Nothing worked. When we finally looked closely at his habits, the issue was simple. He drank nearly all his water between dinner and bedtime. His body was doing its job by sending him to the bathroom, but at the wrong time of day. Once he shifted most of his water to the morning and afternoon, his nights transformed. This is why I always remind my patients, it's not just how much water you drink, it's when you drink it. Timing can either partner with your body's natural rhythm or fight against it. And for older adults, that rhythm matters more than ever. Now, here's something most people don't realize. The common advice of drink 8 glasses of water a day is not wrong, but it's incomplete. The missing piece is distribution. Too many people sip just a little all morning, then suddenly realize they're thirsty in the evening and down 2 or 3 glasses at once. This late hydration forces the kidneys to stay busy while you're trying to rest, and your bladder to fill when it should be quiet. So, what does healthy timing look like? Ideally, most of your water should be consumed between the time you wake up and about 4 p.m. That's when your metabolism, circulation, and kidney function are naturally strongest. Think of water as fuel for the day, not the night. When you load up on fluids earlier, you give your body plenty of time to process and release them while you're active. By the time bedtime comes, your bladder is calmer, your kidneys have slowed down, and your chances of uninterrupted sleep are far higher. Another small but powerful detail, the temperature of the water you drink in the evening matters too. Ice-cold water, especially close to bedtime, can irritate the bladder lining and increase sensitivity. For older adults whose digestion is often slower, cold drinks can also trigger bloating or discomfort. A small glass of room temperature or warm water, on the other hand, is gentler on the system. Let me give you an example. I worked with a woman named Susan, age 72, from Arizona. Every night around 2:30 a.m., she woke up with the urge to go, even though the amount was tiny. When we looked at her evening routine, we found that she was having chamomile tea around 9 p.m., She thought she was helping herself relax, but the extra liquid was setting her bladder up to wake her right when she most needed rest. The fix was simple. She moved her tea to 6:30 p.m. and limited herself to just 2 sips of warm water before bed. Within a week, she was sleeping through till morning, sometimes 6 to 7 hours without interruption. Stories like Susan's and Robert's are common, and they remind us of something important. These issues are not your fault. No one teaches us how to adjust our hydration habits as we get older. We grow up hearing, drink plenty of water, as if the rule never changes. But the truth is, the body at 70 doesn't behave the same way it did at 30. And that's not failure, that's biology. The hopeful news is you can change this starting tonight. By simply adjusting the timing of your fluids, you can retrain your body's rhythm, reduce unnecessary nighttime urges, and reclaim the kind of deep, refreshing sleep that makes mornings feel light again. Now that we've covered how timing your water can change your nights, let's talk about another hidden factor: the foods and drinks you choose in the evening. Many older adults believe that what they eat for dinner doesn't affect their sleep, when in fact, it often plays a bigger role than they realize. Think about your own routine. Maybe you like a bowl of soup in the evening. Maybe you sip on herbal tea after dinner or enjoy a little fruit as a light snack before bed. All of these sound harmless, even healthy. But here's the catch. Every liquid counts as part of your fluid load. A cup of soup, a mug of tea, even a slice of watermelon or an orange can quietly add several ounces of fluid to your system right before bed. And when your bladder is already more sensitive than it used to be, those ounces matter. For example, one of my patients, Carol, age 69, used to make herself a healthy salad every night. It was loaded with cucumber, tomato, and citrus dressing. On paper, that's a smart choice, but in practice, it was almost guaranteed to disrupt her nights. Why? Because cucumbers and tomatoes are high in water, and citrus is acidic. Together, they were filling her bladder and irritating it at the same time. When she moved that salad to lunchtime and switched her evening meal to lightly steamed vegetables, the difference was remarkable. Within a week, she was sleeping 5 to 6 hours without waking. Acidic foods and drinks deserve special mention here. Citrus juice, tomato-based sauces, even carbonated sodas can all make the bladder more reactive. They don't necessarily harm your bladder, but they lower the threshold for urgency. For someone in their 20s, that's hardly noticeable. But for someone in their 60s or 70s, it can mean waking up at 2 a.m. instead of sleeping through. Salt is another quiet culprit. Have you ever noticed feeling especially thirsty after pizza, popcorn, or takeout? That's salt at work. Salty foods in the evening drive you to drink more water later in the night. And when you combine that late fluid intake with aging kidneys and a sensitive bladder, you set yourself up for restless sleep. It's not about never enjoying these foods again. It's about timing and balance. Move the salad, soup, or fruit to earlier in the day, save the salty meals for lunchtime, and keep your dinners lighter, gentler, and less fluid-heavy. Your bladder will thank you. Another habit worth looking at is the comforting evening drink. For many people, it's herbal tea, warm milk, or even decaf coffee. These drinks can feel soothing in the moment, but they're still liquids. And in some cases, they act as diuretics, meaning they encourage your kidneys to produce more urine. Green tea, black tea, and even coffee, yes, even decaf, can push your body in that direction. Let me share another example. Mark, age 74 from Michigan, used to drink a mug of chamomile tea at 9:30 every night. He thought it was helping him sleep, but when we looked closer, the tea was part of the reason he was up twice a night. I suggested he move it to 6 p.m. and replace the late-night drink with a few minutes of deep breathing instead. Within 10 days, his nighttime bathroom trips dropped by half. Here's a small but powerful trick. Create a hydration cutoff point in the evening. After about 7 p.m., stop thinking of fluids as part of your nutrition. At that point, your goal is no longer hydration, it's preparation for sleep. If you do need to take medications at night, use just a few sips of water to swallow them rather than a whole glass. This small shift can keep your bladder calm while still supporting your health needs. And here's something almost no one talks about: the habit of just-in-case bathroom trips. Many older adults get into the pattern of using the bathroom right before bed, even if they don't actually feel the urge. It seems logical. You want to avoid waking later. But what actually happens is the bladder gets trained to send urgency signals earlier and earlier. Over time, you end up waking for small amounts that once wouldn't have bothered you. The better approach is this: trust your body. If you don't feel a genuine urge, skip the pre-bed bathroom trip. And if you do wake up in the middle of the night with a mild signal, pause for a moment. Ask yourself, am I truly full, or is this just a little pressure? Take 5 deep breaths, relax your belly, and see if the signal passes. Training your bladder this way helps reset its threshold and reduces unnecessary nighttime wake-ups. So, let's recap what we've covered so far. Soups, teas, fruits, and watery vegetables are healthy, but only if timed earlier in the day. Acidic and salty foods in the evening can make your bladder more sensitive and increase thirst. Evening drinks, even healthy ones, add up to extra fluid your body doesn't need before bed. The just-in-case bathroom habit can actually make your bladder more reactive over time. What's encouraging is that none of these require drastic changes. You don't need to give up your favorite foods or beverages. You just need to shift them to earlier in the day and create space in the evening for your body to wind down. I always remind my patients, your body is not fighting against you. It's speaking in a different language than it used to. Once you learn that language, through timing, through gentle adjustments, you'll find your nights calmer, your mornings lighter, and your days brighter. We've talked about water timing and evening habits, but here's something many older adults overlook: how your morning and daytime routines affect your sleep. It might seem unrelated, but the way your body handles fluid during the day has a direct impact on nighttime bladder activity. As we age, blood circulation naturally slows down. Fluid can settle in the legs throughout the day, often without us even noticing. When you lie down at night, that fluid moves back toward the kidneys, triggering an increase in urine production precisely when your body wants to rest. This is one of the reasons why many older adults wake at 2 or 3 a.m., even if they drank very little in the evening. The solution is surprisingly simple. Move more in the morning. A short walk in the sun, gentle stretching, or even light leg exercises while sitting can help your body release fluid early. This means your kidneys aren't overworked at night and your bladder stays calmer. You don't need a full workout, just consistent movement to encourage circulation and fluid balance. Sleep position also plays a surprisingly important role. Many older adults sleep on their backs, sometimes with high pillows or heavy mattresses. While this may feel comfortable, it can put pressure on the bladder and slow digestion, making it easier to wake in the night. Doctors, including myself, often recommend sleeping on your left side. Place a soft pillow under your head and another between your knees. This position helps relieve pressure on the bladder, supports digestion, and promotes healthy blood flow. Small adjustments like this can make a noticeable difference in just a few nights. Sleepwear and room environment matter as well. Older adults often associate warmth with comfort, but heavy pajamas or thick blankets can overheat the body, trigger sweating, and increase thirst, which in turn pushes the kidneys to produce more urine and disrupts sleep. Opt for light, breathable fabrics and keep your bedroom airy. Even a simple fan and thin sheets can help your body stay calm and keep your bladder quiet. Another simple technique is deep breathing and gentle abdominal massage before bed. Sit comfortably, place one hand on your chest and the other on your abdomen, and take slow, deep breaths. This helps calm the nervous system and prevents the bladder from sending false urgency signals. A gentle, clockwise massage of the lower belly also relaxes abdominal muscles and promotes digestion, further reducing nighttime urges. Let me share a real example. Jim, 71, from Minnesota, used to wake 3 times each night. His routine included drinking a lot of fluids after 7 p.m. and sleeping on his back with multiple pillows. After we adjusted his water intake to mostly morning and afternoon, taught him side sleeping with a pillow between the knees, and introduced morning stretching, his nights changed dramatically. Within 2 weeks, he was waking only once, and after a month, he was sleeping nearly 7 straight hours. Even small, consistent changes make a big difference. The key is listening to your body and supporting its natural rhythm. Your bladder isn't broken, it's just more sensitive, and your kidneys work differently than they did at 30 or 40. By guiding them gently, you can restore balance without medication or drastic measures. Finally, let's touch on temperature and comfort in the bedroom. The ideal environment for older adults is a cool, ventilated room with minimal heavy blankets. Overheating increases thirst and kidney activity. Pair this with light, breathable sleepwear, and your body can enter the deep, restorative stages of sleep it needs. Remember, the body responds to routine. When you hydrate primarily during the day, eat lighter and gentler meals in the evening, move in the morning, sleep on your side, and maintain a comfortable environment, you're creating a foundation for uninterrupted sleep. It's not a quick fix. It's a rhythm, a way of guiding your body back into harmony with its natural cycles. Another overlooked point: don't panic if you wake up in the middle of the night. Many older adults jump up immediately out of habit. Instead, pause, take a few deep breaths, and check if your bladder truly feels full. Often the urge passes if it's just a false signal. Over time, this trains your body to not overreact to minor sensations, giving you more consistent rest. One final story for this section. Helen, 75 from Minnesota, had been waking twice nightly for years. She tried limiting fluids, changing her mattress, even sleeping medications, but nothing worked. When we introduced side sleeping, morning walks, light bedtime stretches, and a small reduction of evening fluids, she noticed improvement within 1 week. By the end of the month, her sleep was nearly uninterrupted, and she woke genuinely refreshed for the first time in years. This highlights an important principle. Healing doesn't require extreme measures. With gentle, consistent changes, your body often rewards you with restored sleep and more energy during the day. Timing, movement, posture, and environment all work together to help your bladder, kidneys, and nervous system relax and function in harmony. By now, you've learned that water timing, evening foods, and daytime movement all play a critical role in how well you sleep. But many older adults still carry misunderstandings and myths that quietly sabotage rest. Let's clear those up so you can move forward with confidence. Myth 1. Drinking less water during the day prevents nighttime trips to the bathroom. At first, this sounds logical, but here's the reality. When you don't drink enough fluids during the day, your body becomes mildly dehydrated. Your blood thickens, and the kidneys have to work harder. Often, this creates a sudden surge in urine production right when you lie down, exactly the opposite of what you intended. Drinking ample water between morning and late afternoon actually reduces nighttime urgency. It doesn't increase it. Myth 2. Nighttime urination is always caused by the prostate for men. Prostate health is important, but it's not the only factor. Bladder sensitivity, late meals, fluid timing, and overall kidney function all contribute. Women experience similar challenges, showing that nighttime bathroom trips are rarely due to one single organ. Focusing only on the prostate can delay simple lifestyle improvements that bring real relief. Myth 3. Pre-bed bathroom trips help prevent waking up later. While it feels responsible to empty your bladder just in case, over time this habit trains your bladder to overreact. The nerves start sending false urgency signals, making you wake up for small amounts that previously wouldn't have disturbed your sleep. Instead, go only when you truly feel the need and trust your body's signals. Myth 4. Warm drinks late at night improve sleep or digestion. Warm herbal tea or milk can feel comforting, but if consumed too close to bedtime, they still add to your fluid load. Instead, enjoy these drinks earlier in the evening, around 6 to 6:30 p.m., giving your body time to process the liquid without disturbing sleep later. Now that we've cleared up common myths, let's put everything together into a simple nightly routine that respects your body's natural rhythm. 1. Hydrate smartly during the day. Drink most of your fluids between waking up and 4 p.m. Include water-rich foods and soups in the morning or at lunch, not at dinner. 2. Evening meals and drinks. Keep dinners light and low in fluid content. Limit acidic or salty foods late in the day. Move evening herbal teas, coffee alternatives, or light snacks to at least 2 to 3 hours before bedtime. 3. Movement and circulation. Take a short morning walk, stretch arms and legs, or do light leg lifts while seated. These activities help move fluid from your legs back into your circulation earlier, reducing kidney workload at night. 4. Sleep position and comfort. Sleep on your left side with a pillow under your head and another between your knees. Wear light, breathable clothing. Keep the bedroom cool and airy. Avoid heavy blankets that increase sweating and thirst. 5. Mindful pre-bed routine. Sit quietly for 5 minutes, place a hand on your chest and another on your belly, and take slow, deep breaths. Gentle clockwise massage of the lower abdomen relaxes your muscles and bladder. If you wake at night, pause and assess if the urge is real. Take a few deep breaths and relax. Let me share one more story to illustrate how these steps work in real life. Margaret, 73, had been waking 3 times nightly for years. She tried cutting back water, sleeping medications, and even changing mattresses, but nothing worked. Together, we adjusted her water timing, lightened her dinner, introduced morning movement, optimized her sleep posture, and added a brief pre-bed breathing exercise. Within 10 days, her nighttime trips dropped to 1, and by the end of the month, she was sleeping a full 7 hours uninterrupted. Her energy returned, her mood lifted, and she felt a renewed sense of control over her health. The takeaway is clear. You don't need drastic measures to reclaim your sleep. Your body isn't failing. It's just asking for gentle guidance. With thoughtful timing, simple adjustments in meals, hydration, movement, and environment, your bladder, kidneys, and nervous system can work in harmony. Sleep is not a luxury. It's a basic need, a right that your body still remembers. By honoring your changing rhythms, you can wake up feeling refreshed, energized, and ready to embrace your day. And the most empowering part, you have the tools to do it yourself, simply, gently, and naturally. So tonight, try this. Hydrate well in the morning, keep your evening light and calm, move your body in the early hours, sleep on your side, and breathe deeply before bed. Give your body this quiet guidance and let it show you the gift of uninterrupted, healing sleep.